A very good morning to one and all present here. I am Dr. Sara. I'm going to present the paper Perception of CBME Implementation in Ophthalmology, which is a dream-based evaluation among medical students. The educational environment strongly influences medical students' academic achievement, professional development, and well being. As there was a transfer from conventional curriculum to CBME, systematic evaluation of learning climate is essential. The Dundee Ready Educational Environment Measure, developed by Rowe et al., is a validated 50-item questionnaire. It is measuring students' perceptions of their learning environment, covering 5 domains with a maximum score of 200. Our aim was to assess undergraduate medical students' perception of their educational environment using 50-item DREEM questionnaire with 8 institution-specific items, that is DREEM Plus. We took a descriptive cross-sectional survey was conducted at Medical College. Data were collected from 2019 and 2022 batches. 70 MBBS students who consented and completed the 50-item DREEM questionnaire and 8 institution-specific items, DREEM Plus. Now we had 5 domains of DREAM. The first domain was students' perception of learning. It was assessing how students feel about the quality, relevance, and effectiveness of teaching or the learning they receive. The domain 2, students' perception of teachers. It is measuring how students view their teachers in terms of teaching ability, communication skills, attitude, feedback, and encouragement. Domain 3, students' academic self-perception. It is reflecting how confident students feel about their own academic abilities, progress, and preparedness for their future profession. And domain 4, students' perception of atmosphere. It reflects how students feel about the overall learning environment or climate, including academic atmosphere, support, stress, relaxation, and interaction. And domain 5, students' social self-perception. It reflects how students feel about their social life and support system, including friends, opportunities for relaxation, support for stress, and accommodation. DREAM Plus includes 8 questions which are specific to ophthalmology trainings, like adequate hands-on training, use of ophthalmic instruments, case discussions, etc. The 50-item DREAM questionnaire was scored on a 5-point Likert scale plus 8 institution-specific items, DREAM Plus, anonymous classroom administration under supervision, and data was analyzed using Excel and SPSS V25. Now, the interpretation, total DREAM score was out of 200, and 0 to 50, very poor, 51 to 100, plenty of problems, 101 to 150, more positive than negative, 151 to 200, excellent. Individual DREAM item mean score was more than or equal to 3.5, strong positive point, 2 to 3.49 could be enhanced, and less than 2 problematic area. And participant demographics, total participants 70 we took, and mean age 23.5, female count 50, male count 20. Now overall DREAM score, we got 127.4. So here the mean total score is falling within 101 to 150, which shows there was more positive than negative. Now DREAM item analysis domain wise. So domain 1 was focused on students' perception of learning. So here we had a mean more than 2, but we were highlighting a key problematic area on active learner encouragement, where mean was less than 2. Then domain 2, which was focusing on students' perception of teachers. Here highlighting a problematic area on teacher behavior and feedback, where mean was less than 2. Domain 3, focus on students' academic self-perception. We scored mean more than 2. Coming to focus on students' perception of atmosphere, that is domain 4. Here we were highlighting the deficit in interpersonal skill development, where mean was less than 2. And also in the stress and fatigue part of students' perception of atmosphere. Coming to social self-perception, that is domain 5, we had mean more than 2. So overall domain score, we got social self-perception with the maximum 67%, which shows a strong peer support and more positive than negative. And coming to students' perception of teachers, it was 64.3%, again more positive than negative, which is showing a positive faculty review. And academic self-perception was 62%, which showed room for improvement. And students' perception of learning, again 61.4%, room for improvement. Perception of atmosphere, 60%, which had plenty of problems. Now coming to DREAM Plus item analysis, which was specific to ophthalmology, we scored mean between 2.86 to 3. And item total correlation were more than 0.74. That was suggesting excellent internal consistency and very high relevance. So I can conclude by telling that educational environment was perceived as more positive than negative by undergraduate medical students. And we had strong peer support and favorable views of faculties. Areas of improvement was in academic atmosphere and learning methods. So the additional Dream Plus items were also well received, indicating relevance to local academic needs. So findings here align well with the recent Indian studies and highlights the potential impact of integrating CBME aligned elements like mentoring, timely feedback. Continued efforts towards student-centered teaching, wellness support and curriculum refinement are essential. These are my references. Thank you. Yes. Sir, ophthalmology, I was taking mine was, yeah, sir. Sir, we were taking the study as a whole. Uh, yeah, sir, medical college is solely this. Sir, I didn't get you. Oh, okay. Okay. Oh, yes. Ye- Um, uh, yeah. Yeah, ma'am, actually the study was from 2019 and 2020 batches. So the questions were not ophthalmology was only based for the training. We took separate, Dream plus 8 questions. Rest of the questions uh, were common, like it's not specific to ophthalmology, but all, yeah, overall, madam. Uh, yeah, yeah, sir, yeah. It was good, sir. Sir, actually, when during our days, it was more traditional. Like, it was not CBME. So I felt I can see the differences. Like when now students come to our OPD, mainly now I'm in ophthalmology department, so I can see how the CBME has changed them. Like because they started using the more. It is more. Uh, Case-based studies, or they started using the instruments, and I can see that confidence in them, sir. So I think if it was there for us also, it would be better. I felt because I can see the difference, sir. Like when it was our batch, it was traditional. Like it was more syllabus based. Now I can see it is more. It is students. It is students centered. So I feel yes, sir. It is recently introduced. Yes. Okay. Hmm. Okay. 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 Sir. Yeah. Yes, sir. Oh, okay. Okay, sir. Hmm. Okay, sir. Okay, sir. Thank you, sir.